Sure.
Thank you, Mr. Chairman and members of the committee. Thank you for allowing me to testify in favor of AB 104. My name is Dr. Travis Morell. I'm a senior fellow at Do No Harm. The most common gender surgery done on minors, which is mastectomy. At least 7,000 American girls under 18 had complete breast removal in the past 5 years. About 100 were under 12 and a half. I know of one young woman who had a baby after having her breast removed for gender transition that she later regretted. But milk glands that are left behind no longer attached to the skin via ducts. So when the baby was born, her breasts became painfully engorged with milk, with no way to empty them and get rid of her pain. It was a painful reminder of the true medical harm that she experienced. If she chooses to have another child, she'll have the same pain again each time. This bill also prohibits puberty blockers, which are used to stop development of sex traits like genitals and breasts. That's why this is done as early as puberty starts, sometimes age 8 to 13. Transition activists admit that boys whose genital growth is blocked at a young age, if kept on meds to adulthood, they're unaware of any such patients ever having an orgasm in their life, ever. You already know other side effects of blocking hormones if you've gone through menopause. 12-year-olds can have hot flashes, get irritable and weepy. Because puberty blockers starve the growing brain of needed hormones, studies show kids on blockers losing IQ points. A 2024 review of the best data found no evidence that brain loss recovers when the meds are stopped. When the activists say puberty blockers are just a pause, please ask them about the 20-year-old men with 1-inch penises who will never have an orgasm, much less have kids, and the kids whose brains may be permanently stunted. The bill also prohibits cross-sex hormones, the entire point of which is to permanently change the body. Some women regret side effects: male pattern baldness, permanent beard, vaginal bleeding, intense vaginal itching, or painful intercourse. By as young as 18, many have the urinary and bowel issues more common to grandmas than teens. For boys, estrogen increases the risk of testicular cancer. Both sexes get fertility damage. Remember, these decisions are made for kids not only before they ever had sex, but before their bodies are capable of doing it. Doctors are taking away the car keys before they even get their driver's licenses. With research, you may have noticed that one study comes out 1 year saying coffee's bad for you, and then a year later it's life-saving. To combat this confusion in gender medicine, instead of getting lost staring at one tree, doctors study the whole forest with what's called a systematic review. 6 of these reviews in the UK failed to find evidence that gender medicine helps or is safe. Same with 2 out of Canada. 6 studies out of Johns Hopkins University, well, I don't know what they found because they were mostly buried after gender medicine leaders decided to hide results after seeing what we assume was data that didn't help their case. In fact, the highest level evidence is so bad for gender medicine, their own ACLU lawyer admitted that it does not decrease suicide. The main argument supporters use to blackmail parents into these dangerous interventions. For all these reasons, mainstream medical organizations around the world, some that used to encourage gender transition, now urge safety. If opponents claim that they have medical society support, ask them about Finland, Sweden, Norway, Alberta, Canada, Chile, England, Scotland, Wales, Northern Ireland, and Queensland, Austria. Each of these stopped giving these drugs to minors outside of experiments. In the United States, the American Society of Plastic Surgery doesn't think gender-affirming care for adolescents is appropriate. And the European Society of Child and Adolescent Psychiatry, which represents 36 countries, is the same. Your children are depending on you to use your own good judgment to protect them. I urge you to take the opportunity to protect Wisconsin youth and vote yes.
Perfect timing. Thank you. All right, do we have questions for Representative Schneider? Go ahead.
First of all, I read a New York Times article back in 2022 that said transgender children's thinking that they're transgender doubled in 5 years. In your opinion or medical, why do you think that happened?
Yes, it is known that more and more people are identifying as transgender, and I think that the important thing is that we find a way to protect them from any long-term damage, because I personally have helped adults get gender-affirming care, and they need to have the most opportunities available to them when they get adulthood.
Okay. What kind of evidence does it show about any kind of regret rate with these medications in kids?
Representative, that's a very good question. So there's 2 kind of data that we can look at there. For decades, the Psychiatry Bible, the DSM-5 TR, last published 2022, says that as many as 88% of girls and as many as 98% of boys, the gender dysphoria goes away on its own, unmedicated by adulthood. So assumingly, we'd assume that those patients that got these permanent damage from puberty blockers and hormones would probably many have regret. Now, there's also, unfortunately, we rolled this out on kids without actually getting good data. in actual trials. So in the best data that we have, most of it has dropouts of patients. 40% of patients just totally lost. We don't know what happened to them within 4 or sometimes 5 years. We do have a good study in America with 1,000 patients where they found that 30% of patients within about 4 years changed their course. This is with average 19-year-olds. In Germany and in the U.S., we have insurance data that shows most kids within 5 to 7 years detransition. That's insurance data. It's available. It's published. Thank you.
Representative Wickers.
Thank you, Mr. Chairman, and thank you for being here. For the sake of time, it's hard to have a meaningful conversation in under a minute and a half. Can you comment on, you mentioned the rate of suicide. There, in the last session when we had this testimony, there was testimony that said that suicide rate goes up by 19%, and that's increasing every year.
So I'm sure everyone in this room is very concerned about the suicide rate in kids, and it is very high, and ideation is very high in our teens in general, unfortunately. There is some data that does show that patients post-surgery and so forth as adults have higher risk of suicide. The truth is that we don't have good, say, randomized control trials. There's basically no randomized control trials in this. And the problem is that we rolled this out on kids without getting good data. So there are some red flags in that data. The important thing to know about the suicide lie is that when the biggest study that we have was 15,000 kids at the Tavistock UK clinic, which is the biggest clinic basically in the UK. And out of 15,000 kids, they found that there was, unfortunately, 4 suicides, which I would say is 4 too many, but it's a 0.013% rate per year of suicide. I'd like that to be 0. We should do whatever we can to do that. But the problem is that we're seeing that these kids have regret a couple years later. You don't regret these things when you're a kid. You regret it when you become childbearing and want to use your breasts, want to use your ovaries, want to use your uterus. And that's why in many states, including Colorado, just last night, a Democratic rep crossed the line. So I don't think this is a partisan issue that we want to protect kids.
And that was the second question that I had was looking for successes in dialogue. I don't think we're going to have that here today, but the authors said that we've got volumes of doctors and medical institutes putting out data worldwide that are expressing some changes in their policies or their science, saying maybe there is a threshold of age that we've kind of now in hindsight regret pushing so hard with one's, and the bill addresses the minors. It's specific to minors. Have you seen, because it wasn't clearly in your testimony, successes in other states or with other, and you just mentioned Colorado, are there others?
Yeah, there have been a few others, and I think it's increasing. You ask a good question. I listed 9 countries or large regions that had formerly were doing this to kids actively ahead of us, although many of them never did surgery, whereas in our country we've had 12 and 15-year-olds get mastectomies. But they were ahead of us, and now they've gone the other direction. The European Society of Child and Adolescent Psychiatry, which is the major group that represents 36 countries, unique, different psychiatry societies, also said, I quote, they should not promote experimental and unnecessary invasive treatments with unproven psychosocial effects. The prestigious American Society of Plastic Surgery, which is much more supported by its members than, say, the AMA statistically. 95% of plastic surgeons join that. Less than 17% of doctors join the AMA. The ASPS says, quote, they don't think the gender-affirming care for adolescents is appropriate. So all this being said, you have to make a decision on your own, and I don't think you need a doctor to tell you when to brush your teeth. And if I came to you and said I was giving an anorexic liposuction or Ozempic, you should stop me. If I was saying I was doing C-sections on women with false pregnancy, which is a real condition, I've treated pseudocyesis, you should stop me. And the first bill, which was absolutely no argument at all, was on opiate regulation. You guys had no problem regulating that, as well you should. But when I was in training, doctors were overprescribing opiates, and it was caused by my people falling for bad pharmaceutical regulation, and I'm sorry, with respect, by your predecessors in my state, that were regulating how pain meds were given. And what that led to was instead of 10,000 patients a year dying of fentanyl and opiates, we now have 50 or even more, 50,000 people a year dying from opiates. That was medicine's fault, and it was regulators' fault. So please be open-minded about the pain that this is causing, and let's protect these kids. If they grow up, as many of them do, lesbian, gay, or transgender, we should let them make those decisions as adults with their full nerve tissue and brain tissue intact.
I appreciate the information you're giving because it's not yours, it's the actual statistics, data, and observations that you've experienced, and it's not anecdotal. So I appreciate the context that you're offering that's beyond the written testimony. It's valuable. It should be valuable to everybody who's listening. Thank you.
Representative Brooks.
So just to follow up on 2 points, do all medical associations and organizations believe that the AMA is absolutely 100% correct on this? Obviously, you're a doctor and don't agree.
So absolutely not. The American Medical Association, which I was just dying to become a member of when I was a student, now has less than 17% of doctors join it. In my own,
what was that?
It's less than 17%. That compares unfavorably to other organizations like the American Society of Plastic Surgery, of which 95% of possible members belong to that in this country.
17%.
Yes, 17% of the American Medical Association. In my own state, there was a vote. You see, most people think doctors, we all go to the same doctor's lounge every day and get like free donuts and vote on stuff, but that's not really how it works. I'm disappointed to tell you. It's probably a lot more like your job, where we're all in different committees and different offices and so forth, right? If there's a recall at the Toyota plant, your Toyota salesperson didn't do anything wrong to the car. It's one place in one room. And that's what's happened in medicine. So in Colorado, we had a vote, and of the common doctors, 62% voted and said, quote, this is, quote, mutilation, not needs to be reevaluated. If we had a more,
Colorado.
That was in Colorado, which is more blue. We have a Democratic supermajority there. So I listed the 36 countries represented by the European Society, as well as the nine countries that have followed evidence. They went ahead of us, and they're going to head back. Remember, the rep mentioned lobotomy to some laughter. I'll say we kept doing that for 20 years. American doctors, God forgive us, we kept recommending patients put babies down to sleep instead of back to sleep for many years after Australia and Europe changed course, which killed, some people estimate, I don't even want to say, but several thousand babies. And the reason is because we're slow to change, just like any other organization, and we have a lot of our official decisions are made by a few people in a room. Dr. Julia Mason famously led a bunch of people to argue with the American Academy of Pediatrics, and she was basically shut out. I was talking with Dr. Nikki Johnson, a pediatrician who wasn't even allowed to go to the AAP last year, and she's the most nice doctor you'd ever meet. So in 2018, when the American Academy of Pediatrics made their official statement, they did not do a systematic review, which I quoted 8 to you, and not counting the 6, some of which were squelched by the WPATH. They did not do that. She fought for them to do that. And in 2023, they simply reissued, we talked about reissuing a bill, they simply reissued the same statement 5 years later, the American Academy of Pediatrics, the same problem that we have with this being the same bill as last year. Pediatrics did that, not 1 year later, 5 years later, without doing the systematic review. So they're making decisions based on their beliefs, their metaphysical beliefs, and not based on science. And I think that's very concerning for kids, and I hope that you'll be able to protect kids in your state.
Follow-up question. How long did it take from the time our European colleagues, how long did it take to change the opinion, change the way they were doing things over there? Was it a year, 2 years, 10 years?
It's been a long process. So the Tavistock, which is probably one of the world leaders in gender medicine, started their large study to see if this really helped kids. It wasn't truly randomized control, but it was the best that they were willing to do, a prospective study. No one will do a randomized control trial because they say that all the kids that won't do it will commit suicide, which I've already said the data clearly disproves. They started that in 2011. Within 5 years, the data was very concerning. They weren't even able to complete the trial because it was dangerous. The United States is the other country since then that has tried to demonstrate to see if puberty blockers are safe in kids. You may be aware, it's been published in the New York Times. Dr. Johanna Olson-Kennedy received $9.7 million from the NIH. She studied the puberty blockers on kids to see if it helped them. and she found that it didn't help. And unlike medical ethics demand, she chose not only not to publish the data, she openly told the New York Times that she wasn't publishing the data yet, and because she was concerned that it would be used to protect kids from these procedures that she does on a daily basis.
One last question. Personal story. Last year I was 100 pounds heavier. I'm not now. I was able to make that personal choice. Puberty blockers, if I take a puberty blocker or give it to my children at 12 years old, is it just a pause button? I don't think they can reset at age 18 and go through puberty again, can they? You tell me, I'm not a doctor. I didn't profess to be one, so I'm asking.
Once again,
if you hit the pause button, if that's the language that some want to use, can you reset at age 18 and still grow breasts and all the other natural things that would have happened had you not taken those puberty blockers?
Representative, thank you for the question. All of us here who've lived longer than 30 years have seen people grow up from the ages of 10 to 20. And during the ages of 10 to 20, we all grow, not just our genitalia, but also our brains, our bones, our height, other things. Those things are pushed by hormones. Hormones are growth medicines for your body that you need. Every single cell in your body is sexed, regardless of your personal beliefs. Your brain is depending on those hormones. And because of that, there is no pause button because there's no puberty to the sequel. There's no second shot. You've never seen a puberty at 30. And that's why we don't see any evidence in the best quality studies that even the brain results are recoverable after even a few months on the puberty blockers.
But it's not like going on a diet. You can't reset this, for God's sakes. I mean, once you do this, it has permanent, long-lasting effects.
It's been permanent, long-lasting effects. Activists like to point out, oh, well, you guys use that for precocious puberty. When you talk to endocrinologists, first of all, precocious puberty is a physical abnormality when a kid is going through puberty way before the normal time of 8 to 12 and a half or 13. And even endocrinologists hesitate to use it for as short as possible. They don't like to use it because they know the brain, bone, and mental effects of that. So once again, you don't need my permission to brush your teeth. On the other hand, when you look at the evidence, it's just as concerning as you might think, having witnessed mammals for the past thousands of years grow up in Earth through puberty.
Thank you.
Do we have any other questions from the committee? Representative Wickers.
Thank you for giving me one more chance. We have somebody who's traveled here and is a resident expert, so to speak. The number one issue that comes up with parents and school districts with minor children is the fear of suicide. In last session, there was some testimony, and maybe you can clarify it for us, that the rate of suicide isn't any more than it would be with those kids that are having multiple struggles in multiple different areas. So they said it's really not much more than the problems that already exist outside of the gender dysphoria. And that if the kids start to get the therapies, that the suicide rate goes up post receiving those therapies. So that's why some of the other countries are reverting when it comes to the suicide issue, and that's what I'm asking specifically.
So, first of all, great question, and this is the important question to ask. Is it okay to threaten a parent, to take away a kid from a parent, to take away, I talked to a dad yesterday, take away 2 kids from a parent against their will from their house because they're going to commit suicide if they don't get the medical care and the parent doesn't approve. We should think of the family harms as well. And I don't think we have to be honest that with a normal medicine or something as dramatic as putting 8 to 12 and a half or 13-year-olds on puberty blockers, as dramatic as putting 13 to 16-year-olds on cross-sex hormones, possibly doing permanent surgery, as dramatic as that, normally you would do studies to see if it affected the suicide rate. And the truth is that was never done. It was just put on kids ahead of time because of a belief, which is not proven. Now, everything you said, there are studies that tested that, but there is a study in, I believe, Finland that shows that really the suicide rate in gender dysphoria is better accounted for the other psychiatric comorbidities that some patients have, not the gender dysphoria itself. There are some studies that show higher suicide rates, specifically in adults, although there are trends towards higher inpatient admissions for suicide in kids from these medications. But the truth is that, if you don't look at all the different studies, is eggs good for you or bad for you? Is wine good for you, bad for you? Coffee good for you, bad for you? It sometimes goes on the news. If you look at the biggest studies, what are called systematic reviews, in the UK, 6 say it's not proven to help, it's not proven to be safe. In Canada, it's not proven to be safe or it's not proven to help, and that includes suicide. And so the point is that different people are going to pick a study and say this or that, but with the biggest, broadest evidence, if you ask somebody to calmly answer you, the answer is we don't really know, but it sure is a lot closer to less than 0.1% per year, not 1% or 41% or 43% as sometimes quoted, which would be, as bad as it is, that would be truly a horrible atrocity. Yeah, that's all I have for you.
My name is Mara Jarvis. My pronouns are she, her. And if you want to protect children, then end the backlog right now.
Pretty obviously,
End the backlog protects trans lives.
please
without
escort
being
that person out.
Woo.
Woo. Anyone else want to clap? You want to leave? We've got some in the front row and then some in the back corner. You're on your last notice. So the minute anything else happens like that, you'd be asked to leave. All right. Representative Dietrich.
Thank you, Mr. Chair. Thank you, Doctor. You've cited a lot of interesting data in a lot of different countries and states. Is there anything in the data relating Munchausen by proxy with any of this treatment?
You know, I mostly see this as harm that's being perpetrated by adults, especially doctors that should know better, that are doing this to kids. You know, there are some, we all know of situations where multiple people in a family, you know, very uniquely, it seems unsurprising and hard to explain through genetics or biology. But I think the largest problem is that you guys believe our societies and doctors and adults aren't standing up as we should be, and I think that responsibility lies on me. Now, I will say I think it's amazing that I'm probably the only person in this room that's helped create a neovagina in a man or that's prescribed testosterone to adult women. And I've built strong bonds with those patients at that time and in earlier life. And I'm very surprised that this is seen as an anti-trans thing. What got me interested in this is when I realized that this is harming the very adults that we're supposedly helping, because when they become adults, they have less medical and surgical opportunities to them, as well as less relational and sex opportunities to them.
Any Representative Stubbs?
Thank you, Mr. Chairman. Maybe I missed it, but what type of doctor are you?
Yeah, my name is I'm Travis Morell. I'm a dermatologist and dermatopathologist. I represent the many doctors that believe in evidence-based medicine for protecting kids. The first 4 years after I graduated medical school, I practiced in gynecology, doing surgery and family medicine, including gender-affirming care for adults.
Any other questions from the committee? All right, seeing none, thank you, Doctor.
Thank you.